Okay. The broad definition is any couple who are living together who've been trying and to conceive and have not achieved conception in 6 months. Now, that's just general infertility. Then you can break it down into causes. Probably about 40% will be female, another 40 or 30 will be male, and 30% is both of them together. And so, in each category, there are various reasons. I mean, I can talk more about the female that I'm more familiar with. It could be due to any problem with any of the reproductive organs. If you take the womb, that's the uterus, it could be due to lesions or disease of the womb itself, like fibroids. Maybe a previous infection like TB could also cause that. It could be affecting the fallopian tubes, maybe from abnormality of formation when from the time of birth of the woman, or due to blockage, or due to the fact that they've been removed due to previous operations from disease. And it could be the eggs, the ovaries. Some people could go into what is called premature menopause. That's when you go into change of life earlier than usual. It could also be from infection. TB is common in affecting the ovaries and reducing the quality and the number of eggs. It could also be genetic. Some people will have what is called Turner syndrome, in which case they are born generally with fewer eggs than normal. So, quite a lot of diseases. Endometriosis comes to mind, which is a disease where parts of the womb find themselves inside the general abdominal cavity, and they continue to grow like cancer cells. They can lead to deformation of the fallopian tubes, causing blockage, as I explained with other things earlier. So that's so it's a wide variety of causes when we talk about infertility. One of the good things about us as human beings is that over the years, over the thousands of years that we've been on this planet, we've always tried to find solutions to whatever problems we are confronted with. Yes, all these things that I've mentioned have solutions or have remedies that we can offer in all these cases. Obviously, you have to see the patient first, assess, then you determine what type of solution the patient requires. Like I said, it could also be from the male side. And but first one has to know what one is dealing with. And thankfully these days there are various technologies now apart from normal corrective measures which you can help the patients to achieve by herself without surgery or medical treatment. There are technologies that are available in helping couples to conceive. Like anybody else who's got a problem, consult the relevant experts. That's the best thing. Consult, and especially for now, maybe I should speak now to my people now. We have this misconception about things like that. I mean, I saw a couple 2 weeks ago. The wife is in her 40s, the husband is in his 20s, and she had been sterilized previously. And in assessing them, my advice was, I think you should probably consider artificial reproductive techniques, because that will probably give you a better chance than having surgery to have the tubes retied and wait. But the one thing that the husband said that just stuck to my mind, said, it's culturally, it can't go, and obviously you have to be sensitive to that. And I said, look, I'm just giving you my advice as a professional. I think given that the wife is, given the wife's age and stuff, I felt that would be a better chance. They'll have a better chance using, reproductive technology to help than trying to do it in the natural way. Well, it just highlights some of the cultural things that we still have to overcome. I mean, speaking to my colleagues who are infertility specialists, one of the complaints you hear from them is that patients present with late. And I guess as a black person myself, I can understand. But I think, we live in the modern world, where now we have all these therapies, technologies that are available to us to help us in so many ways. And I think if one recognizes one has a problem, seek out the relevant experts. It's all about, and at least get the advice. Because the more you know about your condition, the better you'll be able to make the best decision for you.
And all the time.
Advice for any couple that are suffering from infertility. Firstly, because you need to, I've just told you now, there are various causes of infertility. So you need to first of all have things analyzed and find out which category you belong to. That way, one can begin to plan what kind of therapy you need, or if you don't need any therapy at all.